The ACA Subsidy Cliff. If you're retiring before age 65 and need health insurance from the Affordable Care Act marketplace, there's a financial cliff that could cost you thousands of dollars in a single year. It's called the ACA Subsidy Cliff, and understanding it is essential for anyone who retires before Medicare eligibility. Here's the background. The Affordable Care Act provides premium tax credits to help people afford health insurance purchased through the marketplace. These subsidies are based on your modified adjusted gross income relative to the federal poverty level. For 2026, the enhanced premium subsidies that were introduced during the pandemic and extended multiple times cap your premium contribution at 8.5% of your income for those above 400% of the federal poverty level. However, the original ACA design included a hard cutoff at 400% of the federal poverty level. If your income exceeded that threshold by even $1, you lost all subsidies entirely. For an individual in 2026, 400% of the federal poverty level is approximately $60,240. For a couple, it's approximately $81,160. This cliff meant that earning $60,241 instead of $60,240 could cost you $10,000 or more in lost subsidies. Now, the enhanced subsidies that eliminated the cliff were extended through 2025, and as of this recording, there's been discussion of further extensions. But these enhanced subsidies are not permanent law. They could expire, reinstating the cliff. This makes income planning absolutely critical for early retirees. Let me show you the math. Consider a 60-year-old couple retiring early with income managed to $80,000 per year. Under the enhanced subsidies, they might receive approximately $12,000 in annual premium assistance, making their marketplace plan affordable at around $7,000 per year out of pocket. If the enhanced subsidies expire and the cliff returns, that same couple at $82,000 in income, just slightly above 400% of poverty, would lose their entire $12,000 subsidy and pay the full premium of approximately $19,000 per year. That's a $12,000 swing from a $2,000 income difference. This is where retirement income planning becomes health insurance planning. For early retirees on the ACA marketplace, every dollar of income matters. This includes Social Security benefits, pension income, IRA withdrawals, capital gains, dividends, and even Roth conversions. Yes, Roth conversions count as income for ACA subsidy calculations, which creates a painful trade-off. Converting to Roth now to save taxes later may cost you health insurance subsidies today. Let me walk you through the income sources that count towards your modified adjusted gross income for ACA purposes. Wages and self-employment income count fully. Social Security benefits that are taxable count, which is up to 85% of your benefit. Traditional IRA and 401k withdrawals count fully. Capital gains and dividends count fully. Rental income counts, tax-exempt municipal bond interest counts, even though it's not taxed. Roth conversions count as income. What doesn't count, withdrawals from Roth IRAs, non-taxable Social Security benefits, loan proceeds, and return of basis from non-retirement accounts. This creates a powerful strategy for early retirees. Fund your living expenses primarily from Roth IRA withdrawals, after-tax savings, and cash reserves during the years between retirement and Medicare at 65. By keeping your reportable income low, you maximize your ACA subsidies, potentially saving $10,000 to $15,000 per year in health insurance costs. Here's a practical example. Tom and Sarah retire at 62 with $1.5 million in savings, split between $800,000 in traditional IRAs, $400,000 in Roth IRAs, and $300,000 in taxable brokerage accounts. Their annual spending is $80,000. If they withdraw $80,000 from their traditional IRAs, their MAGI is $80,000, which is close to or above the subsidy cliff. Instead, they withdraw $30,000 from traditional IRAs, creating enough income to get meaningful subsidies, $30,000 from Roth IRAs, which is tax-free and doesn't count as income, and $20,000 from their taxable account, of which only the gains portion counts. Their reportable MAGI might be only $40,000, well below the cliff, qualifying them for approximately $15,000 in annual subsidies. Over 3 years until Medicare at 65, this income sourcing strategy saves them approximately $45,000 in health insurance costs. That's real money that stays in their retirement portfolio. Now let me address the Roth conversion dilemma for early retirees. Many financial planners recommend aggressive Roth conversions during the gap years between retirement and Social Security or RMDs, but every dollar converted increases your MAGI and potentially reduces or eliminates your ACA subsidies. The solution is to calculate the breakpoint carefully. Convert up to the amount that keeps you below the subsidy cliff, then stop. Any additional conversion beyond that point may not be worth the lost subsidy. For example, if the subsidy cliff is at $60,000 for an individual and your base income from withdrawals and Social Security is $35,000, you could convert up to $25,000 to Roth while staying below the cliff. Converting $30,000 instead would push you $5,000 over the cliff and might cost you $8,000 in lost subsidies, making that extra $5,000 conversion very expensive. There are also planning opportunities around the timing of income recognition. If you're selling investments with large capital gains, consider spreading the sales across multiple tax years to keep each year's income below the cliff. If you receive a one-time income event like an inheritance or pension lump sum, understand that it will affect your ACA subsidies for that year. Let me also mention COBRA as a bridge option. If you're leaving an employer with group health insurance, COBRA allows you to continue that coverage for up to 18 months at full cost, plus a 2% administrative fee. While COBRA is expensive because you pay the full premium, including the employer's portion, it can be a useful bridge if your income situation makes ACA subsidies unfavorable for the first year or two of retirement. For those in states that have expanded Medicaid, there's another important threshold. If your income falls below 138% of the federal poverty level, approximately $2,783 for an individual, you may qualify for Medicaid, which provides free or very low-cost coverage. Some early retirees deliberately keep their income in this range during the gap years. Here is your action plan for navigating the ACA subsidy cliff. Step 1. Calculate your projected modified adjusted gross income for each year between retirement and Medicare at 65. Step 2. Identify the federal poverty level thresholds for your household size, particularly 150% for maximum subsidies and 400% for the cliff. Step 3. Plan your income sources strategically, prioritizing Roth withdrawals and after-tax savings to minimize MAGI. Step 4. If doing Roth conversions, calculate the exact amount you can convert while staying below the cliff. Step 5. Check whether the enhanced subsidies have been extended beyond their current expiration. Step 6. Work with a financial planner who understands both tax planning and ACA subsidy optimization, as these two areas are deeply interconnected for early retirees. The ACA subsidy cliff turns health insurance into a retirement income planning problem. Solving it requires coordinating your withdrawal strategy, Roth conversion strategy, and investment income management to stay on the right side of the income thresholds. Getting this right can save you tens of thousands of dollars during the critical gap years between early retirement and Medicare. Let me share some additional data points that drive home the importance of this planning. According to the Kaiser Family Foundation, the average unsubsidized marketplace premium for a 60-year-old is approximately $950 per month, or $11,400 per year. For a couple, that's nearly $23,000 annually. With full subsidies, that same couple might pay $3,000 to $5,000. The difference between optimized and unoptimized income planning during these pre-Medicare years can easily exceed $50,000 over a 3-year bridge period. There's also the issue of income volatility. Early retirees who have significant investment portfolios may experience unexpected capital gains distributions from mutual funds, even if they didn't sell anything. These unexpected distributions count as income and can push you over the subsidy cliff. The solution is to use tax-efficient index funds or ETFs that rarely distribute capital gains, and to hold most investments in tax-advantaged accounts during your ACA subsidy years. One more consideration. If you're married and one spouse is significantly older than the other, the younger spouse may need ACA coverage for a longer period. A couple where one spouse turns 65 and moves to Medicare while the other is 61 will need to plan ACA coverage for the younger spouse for up to 4 additional years. During this period, only the younger spouse needs marketplace coverage, which changes the household size and income calculations. The bottom line is this: the 3 to 5 years between early retirement and Medicare at 65 are some of the most financially consequential of your entire retirement. Health insurance costs during this window can consume a significant portion of your savings if not managed carefully. But with strategic income planning, you can keep your costs low and your subsidies high, preserving more of your portfolio for the decades ahead.
Hey, before you go, if you're serious about your retirement, we'd love to help. Scan the QR code on screen right now or visit the link in the description to book a completely free strategy session with a qualified professional. It only takes a couple minutes to fill out, and there's absolutely no obligation. Take the first step today. We'll see you in the next one.